can you tell me, what is a nurse aide?
A nurse aide is one of the most important adjuncts that a registered nurse can have to work with her. The nurse aide is often the one who is doing the direct hands-on care for the patients, and can be the one that's going to see the first problems begin to emerge with patients.
What kinds of things would you do as a nurse aide?
Well, probably first and foremost are vital signs: temperature, pulse, respirations, and blood pressure, and pain. Pain is the fifth vital sign. So the nurse aide is going to be asking about the patient's pain level and, if necessary, giving that information to the nurse so she can medicate the patient properly. The nurse aide will also bathe the patients. In doing so, she is observing the condition of the skin and letting the nurse know if there are any problems in that area. She is also assisting patients to dress that are not able to dress themselves. He or she will also feed an individual that is not independent enough to feed. Assistance with ambulation, assistance with moving from bed to chair or chair to bed, height and weight, intake and output, particularly on the elderly. When dehydration is a big problem, it's very important for the nurse aide to measure the intake and output of a patient.
Where would a nurse aide work?
Probably what comes to mind first is a facility that cares for elderly patients, a nursing home. Memory care unit is another area. Sometimes nurse aides work for private healthcare agencies going into the home to care for individuals that are unable to care for themselves. Another area that a nurse aide can aspire to is to become a patient care tech, perhaps in a hospital, which means her skills are increased through further education, and she's certified to do more skills that may lead her into entering a program to become a registered nurse.
And lastly, who should take this class?
I think the individual who has the heart, the compassion, the patience, and the desire to help those that are unable to help themselves, and to be an advocate for those individuals that are not able to advocate for themselves.
What is a medication aide?
I'm glad you asked that question. That a medication aide is a nurse assistant who has furthered her education and training a bit and has learned to administer medications primarily to patients in nursing home facilities and memory care units. This means, with the increased education and responsibility that she bears for giving the medication, that her pay scale is a little higher. I mentioned that she has additional responsibilities. Sometimes there are certain assessments that need to be done before a medication is given, as well as after a medication. So these become very important parts of her education.
Now, I know in this interview we were saying she a lot. Could males also take a part of this program?
Yes, primarily what I've seen is that it tends to be a female role, but we certainly do have males in the role, and they've been very successful. And they bring to the plate and to the patient a very different perspective. It's very interesting to see the interactions from time to time.